The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Hey, welcome back, Shifties, to the next episode of the Shift podcast. And for those of you tuning in for the first time, just a reminder that the Shift podcast was made with you in mind. And what we do in every episode is we talk to great influential nurses and friends of nurses in the industry, and we talk about how we can shift our mindset, our tendency, our direction into something positive and something new. And today I have an incredibly special guest. It's a really fun story. Lilian Yew was at the Magnet Conference and it was pouring down rain. And I remember seeing Lilian go into the steps of the Ben Franklin Museum. And we just started chit-chatting about how much we love nursing and how influential we are on society. And I always kept Lilian's business card. And when I decided to launch the podcast, I thought, oh my goodness, Lilian would be such a great guest. And I reached out to her on social media. We became LinkedIn friends. And now I'm thrilled to introduce Lilian on the podcast. Lilian, congratulations. I'm so glad you're here. Great work over in Singapore. Will you tell our Shifties listening a little bit about yourself and what gets you excited the most about nursing?
Hi, thanks, Dr. Andrea, for the opportunity for myself to be in for this Shift podcast. And this is my first time doing the podcast with you. All right, so maybe I can start off with a short introduction about myself. I'm a nurse for more than 31 years, and I have progressed from general ward nurse to ICU nurse to take on the administrative role, and currently I am the chief nurse of Raffles Hospital. So for myself, being the chief nurse for 8 years, basically what I do is I identify and articulate the vision and direction for the discipline of nursing, and I collaborate on implementation of strategies to achieve them. And at this same time, I'm also appointed as the accredited provider program director in 2020, whereby I led this program and helped to achieve the ANCC provider with distinction in March 2020. And 2 years later, in March 2022, we proceeded with the re-accreditation, and we are proud to achieve the ANCC provider with distinction for the second time. And in the same year, I would also want to share that in October 2022, I helped Raffles Hospital, together with my team, we received the ANCC NCPD Premier Award, in which we are the only hospital in Asia receiving this prestigious award that recognizes accredited organizations that excel in NCPD educational activities. So I'm very proud. And of course, in the same year, from November 2022, I'm talking about myself, I became one of the ANCC appraiser team member to help evaluate accreditation applications for NCPD. And of course, throughout my nursing career, I also volunteered to be one of the Singapore Nursing Association board members since 2020. And what I do is I supported the Singapore Nurses Association by promoting the SNA vision and purpose, promoting and encourage the Singapore Nursing Association membership, represent the association at external meetings, events, board meetings, and on the same year in 2022. So I got a lot of things happening in 2022. I was appointed the chairperson for the 16th Tan Chin Tuan Award. We organized the highest accolade dedicated to the enrolled nurse profession in Singapore. So I have done my volunteer job well, and the SNA president requested me to take on the the vice president role. So so currently I'm the appointed or I would say the elected vice president for Singapore Nursing Association. And of course, I also want to share with my academic journey, whereby I include earning a degree and master's in health science from Singapore Institute of Management, whereby they collaborated with University of Sydney in the early 2020s. Oh no, 2000. So it's year 2000, right? Yeah, correct.
Yeah.
Yes. Yes. So throughout my career, I am indeed honored to lead my team to achieve numerous successful hospital accreditation. Yes. So just a short thing about myself, and I find that it is very important. And the thing is, it is quite relevant to Shift Podcast, because I think through this sharing, you can see that what I have been from a general ward nurse to ICU nurse, I think to where I am now, and definitely it's not easy. I believe that perseverance is the key to success. So we need to do our best in terms of provide the best care for our patients. Yeah.
The Shift is brought to you by SE Healthcare. Do you know your current burnout level? Almost 70% of hospitals and healthcare systems can't answer this question. What we do know are the devastating results of burnout: increase in turnover, increase in medication errors and missed care, a decrease in the patient experience, and a decrease in quality outcomes. SE Healthcare can help with our evidence-based approach. Leaders can enhance nurse satisfaction and nurse engagement, improve quality care outcomes, and reduce burnout by 52%. Are you ready to uncover burnout's impact on your team? Visit us at sehealthcaresolutions.com/talk. I have to tell you, Lilian, you have done, just listening to your great story, and you know, we connect on LinkedIn. You have done such incredible work, and every time you do something or achieve something, you're making a shift. Can you tell the Shifty podcasters, our crew here, our squad, tell me a couple or one or two challenges that you face in nursing in Singapore? So what are a couple challenges? And then we'll talk about what you're doing to shift it. So what are some challenges, would you say, Lilian?
So if you look at the challenges in Singapore, I think it is also quite similar to many organizations globally: manpower shortage. Yes. So
Yeah.
manpower shortage is a global issues whereby Singapore is also facing. I think that hits us hard, especially COVID situation that happens few years back, and especially post-pandemic, whereby there is a group of foreign nurses who left Singapore. Yeah, especially in the year 2022, and not only related to shortage of nurses in my hospital, but it's also Singapore side. So it is quite a big challenge, whereby I have to what what I have to do in terms of my side is to motivate my team to work together. Yes, during the COVID situation, the ministry sought various organizations to help, especially we need to set up vaccination center. I can remember. So I just have to tell my team, all right, we need to work together. All right, gather all the manpower. So I have in fact assigned or delegate a group of nurses to help in terms of setting up to 14 vaccination centers in Singapore. So by deploying the nursing manpower, the remaining nurses that I have in the hospital, we have to tell them we need to help one another in terms of deployment. So we are not just looking in terms of my company or my hospital, but in terms of the helping nationally in terms of when we have COVID situation and how we can help the public, right? In terms of the setting up vaccination center. Then after that, we need to deploy manpower in terms of handling COVID treatment, setting the COVID treatment facilities, handling COVID patients. Yes. So I think manpower is a challenge, but we can see the camaraderie among the nursing team, and they are willing to help and they are willing to take on the extra shifts. Yes. So yeah, just a quick small sharing about what happened.
And I think that's a really good point, Lily. And I think having enough nurses across the globe. It's a global challenge. And I believe a lot of our nursing organizations and our nursing schools are working really hard to continue to fill the pipeline so that we do have nurses across the globe. But it's a challenge, and I think we are doing a much better job. And that's really why we're doing this podcast as well, is to really encourage people to get into the profession of nursing because it's so rewarding. And for the people that are in the nursing profession, we can give people different opportunities. And I love what you said about inspired and motivated. That's one of the big things, I always talk about. When you lead a team, you have to keep them interested, you have to keep them involved, and you have to keep them inspired by using innovative mind thoughts. Just mindsets and mind thoughts. So talk to me. I'm really excited to talk about and brag about your book. So will you, and I know the book was, and you can show a picture of it if you want to, you can put it on the screen so everybody watching goes out and buys the book. But it was put together by you, and I think you had mentioned 20 other people contributed to the book. Is that right?
Yes. So I want to share with you. In fact, this book was actually, I must thank the Global Influencers Publishing Company, and in fact it was headed by Miss Shika and Dr. Mira. I remember that time Miss Shika approached me whether I want to be one of the authors to share my stories, my personal stories. For the start, I was quite afraid. I'm not too sure whether I am able to write one of the chapter, but I always tell myself, why not? Just give it a try. And I'm sure I'm able to share what I have done in terms of my own nursing career since 1989 till date, and what are the challenges that I face, and what I can do to inspire the future nurses. Yeah. So this book currently it just announced that it is one of the number one Amazon bestseller book. All right, so you can get it at the Amazon. It is called My Voice, Volume 8, and there are total 20 co-authors that written their stories, and I'm sure it is very, very nice to read the story. And I mean, of course, when you look at it, I also written my own stories of what I have done. And yes, yeah,
So
back to
Lilian, do
you.
you think in that book, when I'm saying when people go buy it, not if, because I know my shifties are going to go out and buy this book. In that book, would you agree that a lot of the stories are talking about shifts in people's life?
Yes, that I do. Because when you look at it, this volume is talking about stories of change. So when there's stories of change, they will be shifting from one um, area to probably doing something different, and also courage and community. So I believe that it is quite relevant to the shifties.
I
Yeah.
love it. This worked out perfect. And so Lilian, what we do at the end of every episode is you and I will give a couple tips or a couple golden nuggets to the people that are listening, which we call the shifties. So one thing that I want everyone to take away from this is, number one, meaningful connections are really important. And Lillian and I wouldn't even be on this shift right now if we didn't have this conversation on the steps in Philadelphia. And we talked about our love of nursing. And since that last time that we met in Philadelphia, Lillian's gone on to do all these great accomplishments that she shared with us. She's co-authored a book. We're launching a podcast. What do you think about that, Lillian? Do you think meaningful connections? I hear you talk about collaboration all the time. How important is that in nursing to build meaningful connections and collaborative efforts?
Yes, I truly agree with you. Meaningful connections and collaborative is very important because we need to collaborate with one another to get things done. And if you to ask me what would I share or certain tips to all the shifties, I think probably when you look at it, if you want to enhance, let's say, talking about nursing leadership, resilience and adaptability are very crucial in navigating the challenges of nursing leadership. And of course, we will need to experience that in order to navigate them. And another things that we want to have a meaningful impact in terms of collaboration with various team and nurses. Continuous learning is the key to stay relevant. So whereby I want to share that last year, I just completed my second master's program in Masters in Education. And it is quite a challenge for me because I have not gone for the studies for the past probably 15 years, because the last one was in year 20s when I graduated in 2005. So it's quite a long while. So moreover, this Masters of Education is nothing related to nursing, but I need to learn on the various curriculum theories and the learning part. And it is quite meaningful because, like for myself, I'm being the APPD, and I need to have this knowledge in order to drive all the nursing education activities together with my education team. Yeah. And the last thing I also want to mention about talking about collaboration, building strong relationship with everyone that we are working together. It is very important. So that's why we need to focus on effective communication, and we need to empathize with them. Yeah. And listen to them.
So Shifties, I'm going to summarize the golden nuggets, the great tips that Lilian and myself want to share. Collaboration is key. Continuing education, be a lifelong learner, embrace every opportunity that you can get to build a relationship with someone and learn something new, and be kind and be compassionate. And if there's a shift, make sure that if there's a shift, you are rooted strongly enough to make that shift. And sometimes it's uncomfortable, but make sure that it's a learning opportunity. So take advantage of all the learning opportunities, because nursing, it's such a profession that you can just learn every single day from somebody. And then I heard you say also, Lilian, leadership is about listening and effective communication and teamwork. And that's what makes our profession so incredible. It helps us serve the global community. And with that, Shifties, I want to say, remember, your shift makes the difference. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.